Discussion comes just a day after the African Union's health watchdog declared the disease a public health emergency. The outbreak has swept through several African countries, particularly the Democratic Republic of Congo. The disease causes fever, muscular aches, and large lesions. I'm now joined by Professor Salim Abdool Karim, the director of the Center for the AIDS Program of Research in South Africa. Prof, a very good afternoon to you. Thank you very much for your time. We've been waiting for the World Health Organization to put together this committee that was going to advise it on whether to make the declaration that many people expect, or Africa has now made. What, in your view, and this is a question I've been asking the experts who have come on the program over the past week, as to why seemingly the WHO was taking a wee bit of time on this one?
A very good afternoon to you, Julio, and to all of your viewers. So MPox has been an illness and a disease and an infection that has been around in Africa for decades. So it's not new. And we usually get small outbreaks, and it gets contained within a few months, a year, and that's the end of the story. And then a little while later, it'll flare up again. And these little outbreaks tended to occur from animal to human spread. So we have been in Africa pretty much used to these outbreaks occurring. The situation now has changed. And what has changed is that we now have a larger number of people who are at risk of getting MPox because they don't have smallpox vaccination. So previously, large numbers of people had been vaccinated, like elderly, like you and me, we are vaccinated against smallpox, but it's the younger people, the children, now that are at risk, and that's what we're seeing. The outbreak in the DRC, more than half of the infections are occurring in children, and they haven't been vaccinated against smallpox. And so that's been one of our challenges, that we now have a larger, more vulnerable population. The second is that we seem to have, in this new clade of virus, this new variant of the virus, it seems to be spreading much more easily than what we are used to. So MPox is a very slow-moving virus. It spreads from one person to the next. You can readily intervene to slow the spread of the virus. What we're seeing now is that that level of close contact has diminished, and that sexual transmission has become quite common. Again, if you look at the mining town in the DRC where the data is available, you see that sex workers, for example, are one of the important risk groups in that population. So sexual transmission, which also involves close contact, has become important. And the third is that we really have a challenge in getting the diagnostics done. Less than half of all the reported cases in the DRC, we have a diagnostic test. And the problem there is that, they're in the midst of a very, a warfare situation. So it's an unstable area. They can't get the samples to the laboratory. So there's a whole range of issues that have created a situation where we now need to be more concerned than we have in the past.
So the Africa Center for Disease Control then did the right thing by declaring MPox a public health emergency of continental security.
Yes, so the way the regulations, rules work at the Africa CDC is that it has the authority to declare a public health emergency that's continent-specific. And to do that, the Director General of the Africa CDC has to constitute and consult an emergency consultative group called the ECG. Now, this group was established, and we have a tenure of 2 years to look at anything that the Director General asks us. So he asked us to review the situation on MPox, and we did so earlier this week. Now, the committee itself comprises 20 scientists and medical researchers. They are from all over Africa. There are 4 from each of the 5 regions of Africa. For Southern Africa, there are 3 scientists from South Africa that serve on it, and I chair this, and Maha Al-Rabat from Egypt is my vice chair. So when we had our meeting, we reviewed in detail all of the evidence that was available. And we, based on that evidence, we made a recommendation to the Director General. And the evidence that we concluded was the following: that the burden of infection is higher now than when MPox was declared a public health emergency by the WHO in 2022. We've had over 17,500 cases so far this year. So we're seeing a lot of cases. And secondly, the cases are going up, so that week by week, we are seeing more and more cases, and that's a concern. But it's also a concern that in the last few weeks, 3 new countries started reporting cases of MPox. So now it's not contained to the DRC or to a handful of countries, it's now spreading more widely. And of course, we have the challenge that we don't have a coordinated response, we don't have access, for example, in several countries to the diagnostics. So for all those reasons, we made a recommendation that comprised 9 points to the Director General, where we unanimously agreed and to recommend to the Director General of the Africa CDC that he should declare MPox a public health emergency of continental security, which he did yesterday in a public announcement.
And then, Prof, does then the declaration deal with issues of underreporting, diagnostics, all these issues that are making it, that have hitherto made it difficult to deal effectively with the disease?
So the declaration does a few things. The first thing it does is that it brings together the continent to deal with this problem. The first thing in solving any problem is to recognize, acknowledge, and understand that you have a problem. The second is to bring the key players that can make this, can help address the situation together. And so that they're not working in isolation, but that they're working all together is a very important part of the solution. And then the third is to mobilize resources. And those are the resources that we need. MPox can be brought under control. It's nothing, it's not like there's some miracle that we need. It's just basic public health measures. Identify every case, do contact tracing, identify, isolate. If you just do those things, you'll basically bring this thing under control. So we've now got to mobilize the resources, bring all of that together, but it's also an opportunity to do important research. Are our diagnostics accurate enough for the 3 clades that are spreading in Africa? Our vaccines, what is the efficacy of the current Jynneos vaccine that we are using? And of course, what are possible new treatments that we could be using in treating this, especially in immunocompromised HIV patients, where we have a particular concern because MPox is quite serious in those patients. So this is an opportunity under the declaration to address many of the shortcomings, but not all.
Professor Salim Abdool Karim, let me thank you so much for your time and insights. He is, of course,